Hi Leela. Luckily, do you know something? Our midsem is just around the corner and I heard something. For our clinical microbiology, measles topic is coming out.
Oh, hi, Prasad. Yeah, recently I've been stressed out about our midsem that's coming all over the corner, and I haven't revised for anything yet. And I'm kind of confused on which topic to be focused on. So, yeah, I have no idea on which topic we should focus.
That is the reason why I called you. Okay, we know we can't do revision face to face. It's okay. We do online. We do online revision. Okay, Leila. So I have go through about measles and I just get to collect about the causes, the causes, the diagnosis and the symptoms. But the rest of the pathogenesis, the treatment, and the extra info about measles, I can't get it.
Oh, no worries, Prasad. I'm a bit acknowledged about measles, and I can share the information to you as well.
I think what we can do, how about I explain to you about the causes, the diagnosis, and the symptoms of measles, and you explain to me about the rest, the treatment, the extra information about the measles, the pathogenesis, and what are the other laboratory diagnoses which I never mentioned, so we can share our knowledge and we can do our revision on this topic. Okay, let me tell you about measles. What I understood about measles. Measles is a virus and it is also known as Rubella virus, and this virus is can spread easily. Okay, this is what I understand about measles, and now let me tell you about the causes of measles. Let me tell you, as I mentioned before, the causes is measles virus. But where do these measles virus stays in our body? First, our nose. Second, our mouth. So these virus like to stay at our nose and our mouth, and from there it can cause the symptoms. Oh, symptoms. Let me tell you the symptoms before I forget. As for symptoms, as what I go through, I get to know if we are infected by measles, we will be having runny nose, body aches, watery eyes, fever. Okay, these are the basic physical symptoms we can see through our naked eyes.
Let me explain the most wonderful part of measles, where you're gonna know how the virus enters the body and work out the symptoms. Let's go. So basically, as I told you earlier, it starts from the transmission where it is spread by droplet, which is cough or sneeze from others. So what will happen after the transmits is the infection initiated when virus deposited on epithelial cell or in respiratory tract such as oropharynx or conjunctive. During 2 to 4 days after the infection, the virus measles proliferates locally in respiratory mucosa and spreads into the lymph node. Lastly, the virus enters the bloodstream in infected leukocyte, primarily monocyte, and it producing primary viremia that disseminates infection throughout the reticuloendothelial system.
So, how are we going to find out? That's where I go for the diagnosis, and I understood certain things which I will share with you now. As for the diagnosis, first the physician will check for sore throat. Is there any rashes? Mm, Besides that, you look for the, as I mentioned before, runny nose, the fever, and after that, even the physician get confused. Okay, maybe these symptoms are general. So how are we going to get to know specific about this missile? He will do a saliva test and a blood test, and both of these tests is going to test for measles virus. And obviously when they do these two, they're going to do the measles virus test, and if it is positive, then for sure it is measles. Oh, I mean the person got infected with measles virus. So this is what I understood about this diagnosis.
Prasad, have you ever wondered what are the complications of measles? Let me explain you. Don't ever look down on measles because the complications are very complicated. The complication of measles can cause ear infection, which result in hearing loss. Where we lost the hearing, it is very serious. Will you believe if I say pneumonia is one of the complications of measles? Because that is the most common cause of death among young children. Apart from that, brain swelling is also a complication of measles, where it leads to convulsion and leave a child to death or with mental disabilities. And the next one is eye disorder, which means as destruction of the cornea, also leads to blindness. And lastly, this is the most rare complication ever, which is fatal brain complication. This is not commonly happening but several years after having measles, so it's very rare. As for the treatment, there is no specific treatment to cure measles, whereas treatment includes provide comfort measure to reduce the symptoms, such as drinking excess water to reduce dehydration. Paracetamol or ibuprofen can be taken to reduce the fever. Lastly, antibiotics are prescribed if the complication appears. Here goes what we should do to prevent from measles. First of all, do not share personal belongings. Secondly, administer medication as prescribed. And most importantly, encourage hand hygiene.
Wow, at last, really, now I'm a bit happy because our mid-sem missiles coming out. So I think we can use all this information and we can do our mid-sem.
Hopefully, what we have just shared would be really, really helpful for our midsem, and let's just aim for it. All the best for you, Prasad. Bye.
Thank you, Leela, for spending your time, and at last we get to do our revision. And let me go and check the timetable, and I will get back to you for other subject as well. See you, Leela. Bye.